Hello, this is the first episode of Gnosis Genesis project, which is about psychoanalysis and psychoanalytic psychotherapy. So today I would like to bring into discussion what is psychoanalysis and how it can help you in case you are facing mental health challenges. I'm a psychologist and a psychoanalytic psychotherapist in formation. So I would like to bring more awareness about the importance of psychoanalysis in our day-to-day lives, and also about the impact that it can have in your life once you decide to begin this cure. So psychoanalysis was created by Freud, and it is a talk therapy. It is about the free speech that the client will perform in the sessions, while the therapist will listen, will address questions to clarify some topics or to go deeper with the discussions, depending on the topic and also depending on the state that the client is in and the stage of the therapy. So, an important thing to mention is the fact that psychoanalysis is the foundation of all psychotherapies. So initially, psychoanalysis came and it was formed from medicine and neurology, because Freud was a neurologist, and he really questioned the importance of understanding what can trigger certain reactions in us, and it's not something that can be explained directly by medicine because it doesn't have a physical cause. It's not like a physical disease. So he went on in asking himself questions, being introspective, observing the people around him, and really started with this amazing scheme which describes the stages of our psyche. And the stages are the conscious part of the psyche, the preconscious, or sometimes called subconscious, and the unconscious. And he focused a lot on the unconscious because that's where a lot of the experiences have been hidden or, just gathered through our experience and existence since the moment when we were in our mother's wombs. And he comes to the conclusion that there are certain experiences in the unconscious which can trigger reactions, symptoms, and they can generate developmental issues or reactions which are abnormal, so to say, but abnormal on a subjective level. And they can take a person out of a normal experience for her. So people come in wanting to talk to a psychotherapist because they struggle with certain things, certain surface things which are described as anxiety, depression, overthinking, insomnia, sometimes with physical reactions in their bodies, which again, after certain investigations, are not related to medical issues, but more to some conflicts that they might have had, or some emotions which are strongly attached to their bodies. And through observation, it can be noticed how much our thoughts are influencing us. But when we're thinking about the thoughts, it's not the thoughts that we're thinking consciously. It is thoughts which are coming from past experiences, from memories, from the relationship which we had with our parents or our caretakers, to other people very close to us, and also to our extended family. The focus in psychoanalysis is the unconscious, because the unconscious, which can be defined in many ways, it's an unknown, infinite place, mental place for all of us. And we are yet to discover, bit by bit, through psychoanalysis, psychotherapy, or counseling sessions, what type of emotional baggage is in there, how we can integrate some of those experiences, and how we can transform our lives through deep psychoanalytic cure and really be better for ourselves. An important aspect to be mentioned here is the fact that through the positive thinking wave, the new age spirituality, it is sometimes promoted the fact that if you do psychotherapy, you are going to heal, and you are going to be whole, and you are going to feel better and amazing, which can sound magnificent, but in reality, things are not actually like that. If we're being more realistic about the process of psychotherapy, it is a complex and difficult process. And sometimes it can get frustrating. But if I would be to describe the process, it is more like a journey, and it is not in a circular motion. It has ups and downs, and sometimes you feel amazing and like you're on the top of the world, and other times you might feel like you are going back to where it all started. And then there are moments when you just feel the flow of the process, and you feel how things start getting better and getting aligned here and there, without, of course, completely eliminating the negative aspects of life, because that's just impossible to do. I wanted to point this important idea that psychoanalysis is the base of all psychotherapies, because I consider that this is an important aspect for the clients to take into consideration when they search for a psychotherapist. And this is no shade, in no way of criticizing other psychotherapists and other forms of psychotherapy, because they have evolved and they were created also because we can't address all type of mental health situations and cases to psychoanalysis, because it does have its own limitations, and that's normal. It is more related to the aspect of the preparation of the psychotherapists and how this is done for them to be ready to work with clients. Psychoanalysis works with complex cases because it has the necessary tools, and the psychoanalytic psychotherapists are prepared to just go very deep with the discussions and also with the emotions of the clients. And this is related to people who want to work on childhood experiences, people who have had severe traumas or traumatic experiences, people who are really struggling in their day-to-day lives, and they also are willing to understand and discover more about their unconscious. If we discuss about topics which are more surface level, so to say, situations which require shorter psychotherapy sessions, psychoanalysis also has tools and methods in doing shorter treatments. So it is not just a long-term form of psychotherapy. And then it does have also ways of treating cases where people have an urgent need, like a crisis, a personal crisis, and they just need to discuss with someone to let that out without necessarily starting a long-term treatment. And it is, if I would be to describe it as how it can feel for a client to be in psychoanalysis, it is a process that can't really be compared to other type of treatments, so to say, or methods of self-healing, if we refer to it as healing, but it's more a transformative process, because it does teach you that there are a lot of things that you can discover about yourself. There are a lot of connections which your psyche does between certain elements and certain people in your life that you might not have been thinking about consciously. And it does help you become more grounded within yourself, because you discover multiple parts of yourself. There are parts that you might have known, there are parts that you might have known but never accepted, and there are also some parts of you which you couldn't have seen because you needed someone else, someone experienced, someone outside of yourself to put a light on them and to show you those parts of yourself. And it does create a sense of connection with the self, with multiple parts of yourself. And it does teach you that you can stay with your emotions without having to run away from them, without having to shut them down, without having to use different coping mechanisms to stop the suffering or the pain. And that eventually at some point the overthinking and that flood of thoughts will start quieting down bit by bit, and you will just be able to dive into the flow of life and of existence, even of the daily tasks, way easier than before. Again, I'm not saying about this that it's something that fixes everything and that you will be a whole new different person and you will never have to worry about anything in your life. It is more about teaching you and guiding you in discovering the answers within yourself, taking certain decisions, and really being more connected with how you're feeling, with the decisions that you're taking, and feeling more present in your body. Because even though we are on a mental field, and even though the psyche is not physically located in our brain, it is part of our mind, we are also working with the body, because the body is the vessel which always reacts to everything that is happening to us. And sometimes we might not get to the realization of something that has happened to us, but our body knows already, because the body also has a memory of its own, and it will react to certain triggers, events, and people and senses, and you might not know why, but it's because that specific information is not directly available to you, because it is deeply hidden within your unconscious. And we also have some mechanisms, self-defense mechanisms, which have developed during our lifetime to protect us, with the risk and the scope of even self-destruction, if possible, because their own scope is the one of defending us. So in psychoanalytic psychotherapy, we are working also with the defense mechanisms that we have. We start observing them, we start feeling once they get activated. But it's important to mention that we are not letting go or getting rid of all of them, because some defense mechanisms can protect you from a bigger issue that can happen, from a bigger reaction. And some of them will stay, others will transform, or they will modify a little bit depending on the scenario and the situation. For example, if you would be in the position of getting confronted with a trigger that would have once literally ruined your entire day, or would have made your body just get into the fight or flight or freeze mode, now being in psychotherapy and processing what has happened, you might get to the point of starting to notice, once your body will become reactive, starting to notice the sensations once you are in contact with that trigger, but your body will not react so harsh on yourself. It will have mild reactions, which you will notice, you will start feeling them. You would be in the position of having the capacity to just feel that emotion, even though it's like it's starting to fill your entire body. But then after a few minutes, the wave, which would normally come with all of those reactions, will slowly start to just calm down. And an important part why that is in psychoanalytic psychotherapy is because during this process we do have our psychotherapist whom we are giving our trust, and the psychotherapist in this process is one of the most important factors, because this person will be there grounding us. This person will be there holding our hands mentally while we will go through personal storms of thoughts and emotions and memories and conflicts and physical reactions and symptoms. And the psychotherapist will be there with a very grounded presence, non-intrusive, non-judgmental. And at some point, when you are in the midst of a storm, either being there in the session or outside of the session, when you would just get confronted with the trigger, you will just feel that presence, like it has been integrated somewhere in your mind, and you would feel as if that person is there holding your hand mentally, and you're not alone when you go through those emotions. And that presence integrated will start giving you confidence that you are capable of facing those challenges. And then bit by bit, moment by moment, you will begin to react differently to the things that are happening to you, to the situations when you might get, confronted with a conflict with someone close to you, and also when you are in conflict with yourself. Psychoanalytic psychotherapy has evolved and is constantly evolving, keeping up with all of the changes that are happening in the world. Some people consider that psychoanalysis is an old way of treating people who had some mental health issues as they were named before. But the reality of it is that everything has changed and has transformed, and we are operating with a current approach to everything that we're doing. Because an important thing that we're learning through psychoanalysis is the fact that our psyche is always dynamic. So our psyche is never stagnant. Our mental energy is constantly moving, is constantly doing something. And through this movement, we are able to go back to see things again from different angles. We are able to come in the present moment, to be in contact with our bodies. We are able to, set up goals and imagine things about our future, and to really learn how to find contentment in life. It's not something that would give you a false positive hope about life. It is a very subjective, individual approach, and it is focused on the uniqueness of each person's life story. That's why you can't meet two people who are doing psychoanalysis, even if they have had similar symptoms or they have been diagnosed by a psychiatrist with the same condition. you will not hear the same journey from both of these people, because each case is being treated individually, and the life story unfolds in front of our eyes when we are discussing with the client. So the beauty of it is that the uniqueness that we're bringing in the session is also what's helping both of us, the therapist and the client, to learn about that particular life story.